Hello，大家早上好。有人在线上了吗？有人在我们的 Facebook page 了吗？有在我们的线上的可以帮我 share 去你们的 page 吗？帮我带你的朋友进来。Welcome to our JNA broadcast page. So 我们的 JNA stand for Jupiter Network Advisor。我是艾佳这边，欢迎来到我们的星期三的 Health Topic 哦。上个星期三我们也是有做 health topic，OK，我们是做关于heart 的 heart attack。今天我们的 topic 呢，是我们也是邀请了一个专科来跟我们学关于 diabetes。So 有进来的朋友帮我打招呼一下 ，say hello，在我们的 page 那边 type hello，so that 我们知道你们已经进来了，可以吗？因为我看不到你们，所以帮我打。hello 可以吗？大家早上好，今天来到我们的第50天的 MCO 了哦，有的已经开始做工了嘛？Hello，有在线上的人可以帮我 share 去你们的 Facebook page 吗？OK，因为等一下我们有一些的小礼物要送给你们，就是跟我们上个星期三一样的，我们有送一个意外保险 personal accident 给你们 ，OK，就是这个东西哦，看不到我那个字 ，OK，就是谁帮我们 share 最多的，我们就会 announce 在我们的 page，OK，then 我们会 contact 你们for 这个小小的礼物。这样你们 share 了，帮我们在 comment 那边把你们 share 了，可以吗？谢谢你们哦。Hello。Welcome to our JNA page, okay? Our JNA stands for Jupiter Network Advisor. So basically what services that we have, okay? We are doing life insurance. At the same time, we're also doing will and trust and also general insurance. So if you have any question about your policy or you have any policy review or you have any insurance general that you want to renew, you also can look for us. Okay? Even will and trust in knowledge or you want to know more information, you also can contact us. All right. So, ready? Anybody inside ready? Okay, we will start shortly. Okay, in 5 minutes time. OK， 我们会在5分钟里面，我们会准时开始。我们请了一个我们的贵宾 ，OK， 他是一个from somewhere Velocity Medical Center 的一个 specialist， 关于这个 endocrinology and diabetes 的。等一下我会小小的介绍他 ，warm welcome。OK， 所以现在我们在等的时候，可以帮我 share 在你们的 page 吗？帮我们 share 在你们的 page， 带你们的朋友进来。Our lovely friend, can you help me to share your Facebook page and tag your friend in, okay, to share to more friends to know about what is this diabetes regarding, okay, so you can have more concern about your own health. Hello, good morning. Hello. OK， 这样我们先来看一些图片好不好 ？OK， 其实你知道 diabetes 是什么吗？大概你们也是应该不是很新的一个东西，对吗 ？OK， 其实我们 diabetes 每个人都知道是因为糖尿病 ，OK， 我们的那个尿会比较甜，就是我们吃可能比较甜的东西，还是我们没有照顾我们的饮食。OK， 所以这个是可能一些我们跟你们 share 的，就是你的 skin 会有这样子的 rashes。So your skin you will have this all rashes, and then this is your mouth also. Some rashes that you can see. For eyes will be like a red spots, okay. And then hand, okay. So you will like this, your hand will be swollen like this, okay. Somebody that maybe they think that is because of the kidney, okay. So it's good that you go and have a checkup for what is actually happening, right? 好了，在线上的朋友帮我们 share 哦，等一下我们有小小的礼物要送给你们，就是我们的意外保险。 OK， 我们多2分钟要准时开始了哦。今天我们邀请了的是 from 这个Sunway Velocity Medical Center， 一个 specialist，OK， 叫 Dr. Lim Kim Piao，OK，so 在这边我们要谢谢他，因为他抽出了他宝贵的时间来跟我们做分享。然后我也是要谢谢他的business development Ellie 来帮我们安排这个sharing talk。Okay, so today we have invited Dr. Lim, okay, from this Sunway Medical Velocity Medical Center to share about a topic regarding diabetes with us. And then I also appreciate and really want to thank the business development Ellie to arrange all the doctors, okay, to share with us about this health topic. 在线上的朋友帮我帮忙 share 一下哦，还有带你们的朋友进来。好的东西我们就是要一起分享，给更多的人一些很有帮助的一些的 information。 OK， 来现在我们要开始了哦，这样我来先介绍一个 warm welcome to introduce our doctor. Okay, so as you can see, so this is some of the information. Okay, this is Dr. Lim Kim Piao. Okay, see, he is from this endocrinology and diabetes, and they are from Sunway Velocity Medical Center. So what is the clinical they focus on? Okay, they focus on this diabetes, obesity, thyroid, okay, adrenal metabolic bone disorder, and also this pituitary disorder. So if you have question regarding a few these things, you can contact him. The contact is below, okay, and the extension is 9355. 这样你们如果有关于这个糖尿病的一些的疑问，你们想问，你们可以 contact Dr. Lim，OK， 他的 location 就是2B-07， 他的 contact 就是在下面我们已经有写了，然后他的 extension 就是9355。OK 哦，这样 Dr. Lim 你那边 OK 了吗 ？Dr. Lim 你那边可以了吗？
可以了，可以了
，OK， 来，我们来给一个掌声，把一个222给 Dr. Lim 好吗？我们来邀请。
222是指什么？
OK， 好
，OK， 可以开始了吗？
可以。
用英文对吗？
可以啦，餐都可以。
餐我可以用华语的可以用华语。不过这里的有不会用英文比较好对吗 ？OK 好。
可以，对是。
So good morning for everybody here. I'm Dr. Lim Kim Piao. I'm from Sunway Velocity Medical Center. I'm so glad and honored to be here to share with you what is diabetes. I'm specialized in endocrinology, especially diabetes. Diabetes is one of the most common disease in endocrinology. And of course, my background specialized also in internal medicines. So today, I will bring you some topics related to diabetes. And before we talk about diabetes, we need to talk about, we call it diabesity, all right? So diabesity is a word of combination of diabetes and obesity. So before we talk about diabetes, we need to talk about obesity because Malaysia is a famous country for obesity, all right? So, okay, I need to introduce, ladies and gentlemen, I need to introduce what is called body mass index. Body mass index is defined as berat divided by tinggi a power of 2. It means that it's a weight in kg divided by height of the square of power of 2. All right. So the in kg and meter in meter sign. All right. So ladies and gentlemen, just take a minute for all of you here and just calculate what is your weight and your height. Okay, just simply take out your smartphone, click into a calculator mode, and put your weight divided by your height. For example, your weight is 75 kg and you are 1.75 meter. So your calculation will be 75 divided by 1.75 divided by 1.75. All right. So give you a minute. All right. Okay. All right. Okay. So if you can see this chart, underweight, normal weight, overweight, obese class 1, 2, and 3. This is the number before on the lower side. All right. So if your BMI is according is 18.5 to 25, we call it normal weight. Overweight is 25 to less than 30 and 30 to 35. Okay. Unfortunately, this is for WHO classifications. All right. So for Asian country, that means Asian country, the BMI category is more tighter. That means in normal range of 18.5 to 25 is normal, but in Asian, if more than 23 is overweight. Okay, ladies and gentlemen, it's easy to get overweight and obese, we call it overweight, and it's also very easy to obese 1, 2, 3. Okay, like me, my weight is 68, I'm 1.774 meters, I'm almost 22.2. Okay, so if it's more than a bit more, is already considered overweight. Okay, why is important? Because this is important for prevention. Okay, obesity crisis. This is from state. 2 billion people now overweight, and United States is one of the fattest nations on earth. All right, this is 2017. Now it's 2020. This figure is epidemiology of obesity in Asian trends. All right, overweight population in Southeast Asia, overweight prevalence in both sex, they classify BMI more than 25, not 23. And you can see Malaysia is the most obese country. Again, Malaysia is the most obese country of 44.2%. Okay. This is a chart of NHMS, National Health Morbidity Survey. Every 5 years we do one. And now the latest is 2019 is coming up. And we found that the trend is getting higher and higher. All right, it's almost, we take overweight and obese, almost is 47% are obese or overweight. Okay, let us try. Male or female? Because usually I will talk to the public when there is a stage. Male or female? Which gender that you consider is more obese? Okay, of course all right. So let us maybe the chairperson can give a guess. 请问一下，肥胖症男还是女比较多？猜一下。
猜一下，我觉得是50-50哦。
50-50啦。Okay, so the answer is overweight is male, obese is female in Malaysia. Okay, according to 2015 National Health Morbidity Survey. Okay, which ethnicity, which race, 什么种族？华乌印，你认为哪一个比较多？在华乌印3大种族里面，哪一个比较肥胖的？
我觉得是印度人诶。
印度人啊，好 ，OK. So the result is out. The obese, the Indian ethnicity is the highest obesity. All right. The Malay is the second one. All right. So this is not being racist, but I just want to recognize which races, which ethnicity has the most obese country. Okay, which state is the most obese? 哪一州最肥胖？
这样如果是印度人，是不是Indian呢
Indian， 对。Which state？ 哪一州？马来西亚。
马来西亚。
哪一州？
哪一州啊？Johor。
Johor。OK。为什么呢 ？Johor 好吃好住吗 ？Johor？
对，比较多印度人呢。
Okay. We will try not to be racial thoughts, but unfortunately, Putrajaya is the number one according to the 2015 data. Okay, so why I say obesity is so important, because the obesity is related to 3H. In Chinese, we call it San Kao. In Malay, we call it Tiga Tinggi. All right. In English, we call it Tiga High. Tiga High. 3 high. What are high? Number one, blood pressure is high, cholesterol is high, sugar is high. So obesity are associated with 3 high: hypertension, dyslipidemia, and diabetes. So diabetes, it means diabetes plus obesity. So before you got type 2 diabetes, most of us, other than genetic, other than a rare condition, we call a rare condition, it happened in lean patients. Most of Malaysians have diabetes, has obese, at least, okay, is overweight. Okay, trend of diabetes is increasing throughout the years. And what is worrying is, if we give projections from here, previous data, 17.5% of more than 18 years old people, the population is diabetic, and half of them are undiagnosed. That means 1 in 6. That means what if we have 600 of people online now, there are 100 people having diabetes, and among the 100, 50 of them do not know. So it shows how severe of diabetes in Malaysia. All right. But the most worrying part is, if we draw the line up to 2025, the current is 2015 is 1 in 6, 2020 projection is 1 in 4. I'm not surprised. And 2025 is 1 in 3. So diabetes occurred in 35% of the Malaysian population. This is very horrible. Okay, imagine we have Bobby here, we have our chairperson Lim Aijia here, and me. In 2025, 1 in 3 having diabetes. So one of us, of the 3 of us here, having diabetes. Okay? All right. So this is a worrying data. Okay, 1 per 6, 1 per 4, 1 per 3. So please remember, diabetes always associated with obesity. What are the complications of diabetes? All right. Number 1, cancer. What are the disease in your mind you are very worried? Of course, death. Okay. What lead to death? Number 1, you will think about cancer, right? But this is something we do not know. Obesity is associated with cancer. Associated means high risk. It doesn't mean obese definitely got cancer. No obese, no cancer. It's not about that. It means that risk. That means obesity is associated with increased potential or increased prevalence of cancer. Diabetes too. So if you have obesity and diabetes, it just gives double risk, higher than cancer. What cancer you get? Okay, the risk ratio for cancer per 5, higher BMI. All right. So we call esophageal adenocarcinoma. It means that 食道炎、食道癌、thyroid 甲状腺癌、colon 大肠癌, renal, liver, whatever you can mention here, all got increased risk. Endometrial, okay, breast cancer, all right? So the strong associations is occur in a patient who has obesity. The higher BMI you go up, the higher cancer is going up, all right? Okay, so the other condition is obstructive sleep apnea, okay? Obstructive sleep apnea is a condition of when you are sleeping, because you have your quality of sleep or the rhythm of sleep was disrupted due to obesity, due to the structural and the functional of the lungs when related to obese was impaired or was reduced due to obesity. What will happen is the patient usually will complain of daily somnolence, will feel very tired in the daytime when they are trying to rest or try to concentrate or driving, waiting for the traffic light to turn, or watching a movie at home, reading newspaper, they are start feeling very tired and doze off, feel asleep. The second most common is usually the partner will complain that he or she is snoring during sleeping. So if you're obese and you have snoring complained by your partners, and you have feel tired all the time during daytime, most likely you have obstructive sleep apnea. Okay, so the medical complications of obesity related to all this, which is very worrying. Okay, the chairperson Lim noted last week we are talking about coronary heart disease. Okay, so chronic heart disease, never mention, never forget that it's not only heart itself, is related to diabetes, dyslipidemia, and hypertension. 3H 三高心冠状肺不是那个心脏病的问题呢，是 related to 三高的。Okay, so the obesity also related to pulmonary disease, which is have lung issues. You also got fatty liver. Okay, most of us have fatty liver. Okay, if you do an ultrasound abdomen, the findings are always related to fatty liver, 脂肪肝. Okay, the other thing is gallbladder disease, easily get gallbladder stone, and also gynecologic abnormalities, usually have PCOS and infertility. Okay, the other thing is it easily got cancer, as I mentioned, gout, skin issues, and osteoarthritis. That means 关节炎 is because the joint try to withhold or try to can't afford the weight itself. So sooner or later you feel have knee pain on your both sides. Okay, so very importantly, these things are the thing I want to mention. Not to forget GERD symptoms. GERD symptoms is GERD, which is gastroesophageal reflux disease, easily get gastritis. That means you have heartburn, acid back towards to esophageal, and you feel gastric abdominal discomfort. Okay, so I'm telling you obesity, I'm telling you complications, but you start to feel worried, correct? Okay, I'm not here to only scare you. I'm not here to threaten you only, but I make you aware about the medical complications of obesity. Let me allow to say about in Chinese. 我们时常说，什么东西是万病之源呢？到底什么病呢是最重要的万病之源呢？我觉得肥胖症就是万病之源。在这个时代呢，我们很重要的一点就是我们在文明病里面呢，肥胖症首要的，我们需要重视它。Okay, I'm talking about obesity is the root cause of every disease now, almost every disease, other than genetic, almost every disease. Okay, so the good news is if you have lose weight, okay, you have lose weight significantly 5% to 10% over 6 months. If you have 100 kg, you lose 5 to 10 kg and continue to lose weight and maintain it 6 to 12 months, your all this disease, okay, what I mentioned, that is more than 50% resolved. Okay, so this is not a disease that chop you will get a permanent disease or complications and you cannot reverse it. Okay, this is a disease. Obesity is a disease, my dear friends, ladies and gentlemen, is a disease, and this disease can be reversible simply due to weight loss. Okay, so we are talking about COVID now. Okay, COVID-19 outbreak. It starts from December from Wuhan, China, and this is this virus. And we now in a panic conditions. Everyone need temperature, and we need to wear masks. We have a new norm, and this is Malaysia. Took a picture here. Everybody are wearing PPE, mask, and people are worried of death, reopening. The other hand, we are worried about our economic crisis because MCO lead to less people, less business, and so on and so forth. And don't forget, COVID prevention still remains important. Is wash your hand, coughing ethics, wear masks, and avoid human contact. That means social distancing. This lasts for at least 2 to 3 years, and this is an important message we have to practice now. Otherwise, like what I said, if not the statistic, I'm afraid will be increasing. All right. Okay. So this is an article. It shows that critical characteristic of 99 cases of 2019 novel coronavirus pneumonia in Wuhan, China, and its descriptive study. It noted something. Old age, obesity, and presence of comorbidity might be associated with increased mortality. Okay, older people, diabetes, people with HIV infections. So I would like to call upon something is this is not only happen in China, it's also it's a repurcast, or we call it is an important message that the people who have the patients with COVID who have more morbidity or mortality or staying longer in hospital in Malaysia, the people who died of COVID virus is due to old age and due to comorbidity. And number 3 things, comorbidity is high blood pressure. Number 2 is diabetes. All right, and they are related to obesity. So if you want to prevent COVID, you also need to prevent obesity and diabetes, correct? So this is a long way down. It's a long battle. Okay, so it's not only COVID virus, H1N1 virus, influenza A virus, H1N1 is also H3N2 whatever A1 virus. Okay, this is MERS-CoV virus and dengue virus also. All right, I just give a talk about in one of the talk. We now not only need to prevent COVID, we need to prevent dengue. So I take this opportunity to create awareness. Now it's the raining season. Dengue virus will be recur back soon, a very potential risk, and it will cause an extra burden to the frontliner, because dengue and COVID can be mixture. All right, it can be a mix. All right, so again, obesity happen and diabetes with dengue, more mortality, more morbidity soon. All right, So, oops, did I click wrongly? Okay, no, right. So, diabetes and diabesity is genetic versus environmental. So, if you have a first degree relatives or family who have diabetes, you have to be very careful with your weight. For example, if your parents have diabetes, all right, so if your dad has diabetes, you have most likely you will inherit his gene and become diabetic soon. If you have both parents having diabetes and in early age, you are more prone to have diabetes. If your parents' diabetes occur in very early age, like 40 years old, you most likely have diabetes at 30 years old. So if you are not taking care of your BMI very well, okay? Again, if you have diabetes at age 40, you likely, if you're not careful enough, you have diabetic complication, especially you have end-stage renal failure. That means you need dialysis at 10 to 15 years later. It can be far earlier if you have obese plus smoking plus other genetic predisposed. Okay, so if you calculate like this, your parents 40 years old diabetes, so you might have diabetes at early age, 30 years old. All right, ladies and gentlemen, so you calculate 40 years old end stage renal failure. Okay, this is a serious matter. 40 years old end stage renal failure. When you dialyze, your life expectancy will reduce significantly. So you might bye-bye at age 45. Okay, when you dialyze, your heart disease increase, your complications increase. All right, so this is not joking, but is true data that I would like to share with you. What are the environmental factors or all our fast food and sedentary lifestyle, okay, that create a opportunity for all of us to get diabetes. All right, so energy balance is important. How much you eat, how much you out. So alcohol, food, carbohydrate is in, energy is out. Okay, physical. Okay, so you can drop your weight by diet control and also by exercise. All right. Okay. So what is Pinggan Sehat Malaysia Suku-suku separuh? Most of us take is different from this pinggan, correct? Most of us take one bowl, the full of rice, a little bit of meat, a little bit of vegetables with a lot of curry, all right? Okay, or hamburger, okay? Hamburger, French fries, potato chips, and with soft drinks, Coca-Cola or whatever. Now the trend is drinking all bubble tea and all these very sweety drinks. Okay, but in fact, what is important here, the plate show very clearly, we should take only half, 1/4 of rice, meat, or carbohydrate, 1/4 of protein meat, and 1/2 portions of fruits and vegetables. But be careful, if you want a balanced and healthy diet is the word. It's not that if I say fruits is important, it doesn't mean that you take a lot of fruits it's good. I saw people don't take rice, don't take protein. He take one bowl of papaya, okay, and one big bowl of papaya. Yes, it provides good vitamins and good carbohydrate and calories, but it is not balanced. Okay, it also will turn into fat into your body if you try to take so much of fruits. Okay, so a balanced and healthy diet is important. exercise is good. All right. Okay. 10,000 steps per day is important, or equivalent is 30 minutes of aerobic exercise. How do you say aerobic? That means 30 minutes of exercise as evidenced by sweating and high good heart pounding is the measurable thing in your exercise. Physical exercise is important. Recommended is running, walking, jogging, cycling, dancing, and doing some cardio workout. Tapata, okay, T-A-B-A-T-A, exercise is good. If you don't exercise, having exercise, you try to exercise from a shorter duration to a longer duration. Start slow, doesn't matter, but you have to very determined and targeted. All right, so doing Tapada exercise, 4 minutes per day, and increase slowly to 2 cycle, 3 cycle, 4 cycle. You can download the Tapada exercise or any cardio workout from the YouTube. All right. Okay. So anti-obesity drugs is important. You can choose from here, but it comes with the side effects. It's only prescribed by physicians. Okay. And this cannot work without exercise and diet control, okay, in long term. All right. So I would like to introduce what is called metabolic and bariatric surgery. That means this is simply called gastric remove part of the stomach, and it is quite a safe and with a less risk and complications. Can be done in any hospital that provide bariatric surgery. However, it also comes with some risks, and it needs a lifestyle modification first, like what I say, exercise and diet. Okay, so bariatric surgery can't work without exercise and diet. All right, it can help significantly reduce weight and also reduce the prevalence of diabetes. So this picture answer a lot of questions, give a message very clearly. Diet is important, exercise is important. So obesity is more than an issue of size. Okay, start early, all right, not to start later. Okay, BMI of 30 is easier to lose weight than later of BMI of 40. Okay, because BMI of 40, when you try to control your diet, you have your gastric, that means your gastric reflux restrict you from having to restrict you from weight loss. Same as exercise. BMI of 40, you have osteoarthritis, you have knee pain. So your exercise can be not as effective as what you can practice when your BMI is 30. Okay, so eat healthy and recognize it, have a target, and exercise and eat healthy. Okay, so the conclusion is we know that Malaysia is a very high prevalence diabetes, and diabetes can give you a lot of medical complications, and a lot of medical complications can be reduced by weight loss, and weight loss 5 to 10% for the period of 6 and maintain for the 6 months, and maintain the rest of your life, and continue to lose weight can reduce significantly your complication of obesity. And exercise and diet control remained the main treatment for obesity, and anti-obesity drugs can be one of the medications. And there are a lot of drugs, but need to prescribe by doctors and monitoring because it is not risk-free, same as metabolic surgery. A lot of patients have survived very well and free from obesity and diabetes via metabolic surgery. So diabetes prevention versus treatment. which is more important? Of course, prevention is better than cure. Okay, so I think, okay, so, okay, sorry. I think this is the last slide. And then, just a movement. And I have more slides actually. Okay, so World Diabetes Day is always 14 November, but this year is a bit different because of COVID. And the diabetes last year is to protect your family. Okay, like what I say, diabetes not only yourself, is also from your family. So if you want to lose weight together with your family. If you want to treat diabetes, create awareness in your family. So in a family, and you can prevent diabetes, you can treat diabetes, and diabetes is not just number of sugar, not only sugar level, but also it comes with complications. The complication of diabetes is eye. You can get blind. All right. Number two, it can get kidney failure, dialysis. You can have your feet problem, diabetic foot. You cannot walk, because most of our job need both limbs. Like let's say a lorry driver, a patient who work as a teacher. You need eyes, you need a hand, you need a leg. All right, and with your diabetes, you are prone to have heart disease and also stroke. If you get stroke, you create burden to the family. You create some burden to the medical burden. So if you can treat diabetes early, you can prevent complications. And the complications come with economic. Most of the audience here are agent, right? Insurance agent. So very importantly is if you have diabetes and obesity, treating diabetes and obesity is cheaper. Is definitely cheaper than you treat dialysis. With dialysis, treat with angiogram, cardiac catheterizations, or CABG, the bypass surgery, or stroke management, or even very easily hospitalizations. All right. So treating diabetes and obesity earlier is to prevent you to have more economic burden later. Okay. This is a very important message to all of us, especially we stay in Malaysia. Okay. So thank you very much. Thank you very much for your attention. I'm ready to receive any questions. Okay, so allow me to summarize in Chinese, because I understand we have Chinese audience here. Okay, so number one is 观众朋友哈。OK， 今天呢，我们今天要讲的东西是糖尿病哈。糖尿病呢，在马来西亚呢，糖尿病是越来越严重啊。然后呢，第二个呢是肥胖症啊，肥胖症马来西亚是首一的 ，OK， 在东南亚是首一的。然后呢，肥胖症呢是万病之源啊，它呢带来了很多的生理和心理上的问题。刚才我忘记说，肥胖症的人呢很容易得到忧郁症啊，所以它不只是生理，也是影响心理。所以它生理方面呢是从头到尾三高糖尿就是糖尿病、高血压和高胆固醇，不只是这样，肺部会产生问题，心脏病啦、肾脏病啦、脂肪肝啦、胆生石啦等等。从头到尾的是从头部到脚部都有很多的问题。Alright， 更重要的是，如果你们可以减胖的话呢，减肥的话呢，它是可以降低这个风险的。哦，它最 最好的、最美妙的地方就是你肥胖症会造成很多问题。同样的，你减肥，它立刻它的风险就降低了。所以肥胖症和糖尿病呢，是我们需要重视的。除此之外，如何降低使到减肥呢？减肥不是说你来减肥啦，注意吃啦，运动呢就可以解决的它是要经过step by steps，就是要知道他必须要知道肥胖症的危险，然后他也要知道肥胖症是可以被解决的，然后他需要一个目标，然后要一个很 structure 有系统性的减肥，比如食物他要看营养师然后跟着营养师看一次其实不够的，要跟着营养师，他需要 self motivation， 他需要自我鼓励，他需要自律，他也需要别人的鼓励，家庭的鼓励，如家庭的改变的生活等等，他需要运动。开始运动的时候是很辛苦的，但是当运动久了，因为我们运动的时候呢，我们的身体的多巴胺我们的内啡肽呢会分泌出快乐荷尔蒙，然后呢，他这个生活就完全改变了。所以当完全改变呢，风险就会降低。当风险会降低的时候呢，它这个可以解决。如果你得到糖尿病呢，单单运动还有是不足够的，是要找医生来治疗。所以呢，他需要吃药，然后呢，减肥手术呢也可以，但是任何的药物呢控制呢等等都需要医生的底下的治疗底下才是安全的，因为每个药物甚至是手术等等都是有一定的风险。OK， 我就这样，我就谢谢大家我现在可以接受任何的问题，谢谢。
谢谢 Dr. Lim，OK， 来，我们来给多一点赞 ，like 跟 love 给 Dr. Lim， 就谢谢他的这个分享。哎，下子这样我们现在来做一些那个，我们来开放给Q&A session 哦。哎，这样子有没有 question 要问现在我们要开那个 screen
OK。
有吗？下子still this slide is it there?
You want to do what?
The main page so that the question can appear 吗
不随便。
Doctor 你要关掉你的那个 slide 一下 Dr. Lim。
OK， 好，关掉
Thank you。你要关掉你的 slide 先。
OK， 关了吗？
还没有嘞，还有嘞。
我怕等一下我全部关完呢。
啊，没有，你关那个 slide 罢了，你的 Zoom 那边你开住，你不要关掉你的 Zoom，因为你的 slide 是你开在另外一边。
等一下，我不知道。
OK， 不用紧，这样子我们先问第一个 question 好不好？哇，我们 OK 来这边有一个question 是他想问一下 how to control the sugar level if the patient has diabetes？
Okay, how to control sugar level?
如果他已经是 if the patient has diabetes， 已经有 diabetes。
Okay, if the patient got diabetes, what importantly is we need to recognize that sugar level is controlled by three things. Number one is diet. Number two is exercise. Number three is medications. If you are diabetic, you most likely you need medications. Okay, when you're diabetic, you need medications. Okay, so medication usually will have reduce your sugar. Number two, your diet will increase or reduce your sugar. Number three is exercise will reduce your sugar. All right. So how do you know your sugar is being reduced or increased? Is by glucometer. So glucometer is important to monitor your sugar. All right. Normally depends individual. Normally, I would say normal patients with newly diagnosed, what are the sugar level? Less than 6 before eating. Before eating, less than 6. After eating, 8.5. Okay, less than 8.5. All right. So the range can be varies from individual to individual. It's different. All right. But the second one is the diabetes itself. Apart from varies from individual, is we need to prevent hypoglycemia. So hypoglycemia means sugar is low. So the range of the sugar before eating should be 4.5 to 6. Okay, if you are very tight control, people will some doctors will recommend you less than 5.6. But generally, I would say 4 to 6 is good. Okay, so before eating 4 to 6. And what are the factors that influence is diet, exercise, and medications. So medication itself, there are so many medications plus insulin. So you have to know what medications you are taking on. The second one is your diet. If you call about diet, it's a mixture of carbohydrate, protein, and fat. And carbohydrate called simple carbohydrate, complex carbohydrate, and with different glycemic index. So the quantity of the carbohydrate, different food have different kind of different portions. So it's very hard to explain in a few sentences. All right. So same towards to the exercise also. What kind of exercise? Duration of exercise, how long you are doing, how intense of the exercise, and do you rest in between your exercise? Do you take enough water during exercise? And also how frequent you do exercise, at what time you do exercise. So it varies. Okay, so these three main things varies. So it's a complex, I would say it's very complex to reply these questions because it's individualized. So, but generally, I can give you a picture, a general picture of how to control sugar in patient with diabetes. Sorry, because
你要关掉那个 slide
关掉关掉那个 slide presentation。
slide。OK。
OK， 关了。Yeah，OK。
哦，可以啊，现在啊，可以啊。So OK， 这样你们有 question 的可以在下面我们那边 comment 那边 type 那个 question。OK，so you have any question you can type below at the Facebook page comment there. Then we can pose a question to doctor. Okay，so now doctor, the next question will be my father always check blood glucose level 20 to 27 ml per liter, but he feel he is okay and healthy without taking medication. So it is okay to him, and can he fasting?
Fasting because Ramadan, right? Okay.
Yeah.
Okay. Just a general comment because I see diabetic patient as a very comprehensive. That means I'm not looking on your sugar only. I have to look on various parameters from your age, gender, how long, what is your comorbidity, is there any other medical problem, how is your complications, your blood results, what is your patient preference. Diabetes is not an easy disease to treat, okay? But based on your information, I can give you a rough idea. Number one, our sugar normal is 6. Less a normal patient, diabetic, normal patient, the sugar at any time should maintain in regular is 4 to 5.6. Okay, so you are mentioned of 20 to 27. I believe it is very, very high. Okay, so this is not only require medication. In fact, he required insulin therapy. I recommend you to see doctor as soon as possible. All right, this is number one. Number two, a patient who have a very high sugar like this easily get diabetic emergency, such as diabetic ketoacidosis. Okay, it's a diabetic emergency that can lead to fatal. Fatal means can lead to death. All right, because the patient normally that DKA usually we have to send the patient to HDU or ICU, and if the severe one require intubations. Okay, number two, the diabetic emergency, we call it HSS. Okay, HSS is another condition with a very high sugar. All right, if your normal sugar is 20 to 27, if you have any problem in your in attack, let's say you have bleed, you have infections, you have heart attack, you have some minor infections or whatever, it's easily tilt the patients to very, very high sugars. I've seen before patients with sugar of 50 to 60, and it's very dangerous. So my advice is, number one, see doctor as soon as possible. Number two is you need medications. Number three is it's very high risk to have diabetic emergency. Number four is I believe your HbA1c is more than 10. Any patients HbA1c more than 10, according to the guidelines, diabetes in Ramadan are advised not to fast. Okay, this is according to the Muslim associations internationally. HbA1c, in fact, is more than 9% and considered very high risk category, and is advised not to fast. Okay.
Okay, thank you. So Siti Fatima, okay, the doctor answer your question. Okay, so our next question. Our next question is, doctor, what is the difference between type 1 and type 2?
Okay, good. Okay, so diabetes classifications, generally we if you type Google WHO or any diabetic associations, diabetes classifications can be as detailed as many as more than 10 types. Okay, but roughly type 1 and type 2. Generally, type 1 is insulin deficit. Type 2 is insulin resistance. type 1 occur in a younger age, and it is not much related to family disorder, and type 1 diabetes require insulin lifetime. It happened in a patient in a very lean body mass. That means it occurred in the teen patients, and it usually come with diagnosed when the patients admitted to hospital, especially for just now what I mentioned, DKA, diabetic ketoacidosis. However, type 2 diabetes is more prevalent in Malaysians. It happen in obese patient in later age. It comes with insulin resistance. Sometimes it requires insulin initially and oral medication in response to oral medications. And type 2 diabetes is require diet and exercise more. Okay. However, at this era, type 1 and type 2, as I say, it can be mixed. Okay. Last time, what we find in type 1 happened in children, in adolescents, in younger age, and type 2 in elderly, more than age of 40. But because of obesity, the type 2 diabetes is getting younger and younger, and we found that childhood obesity lead to childhood and adolescents type 2 diabetes. Okay, so in pediatrics population, we get more type 2 diabetes. Okay, similarity is high sugar, come with complications, but a difference is the mode of treatment and the complications rates. Okay.
Okay. So another question, doctor, is how do you define pulmonary disease? As just now you did mention pulmonary disease.
Okay, thank you. Pulmonary disease is pulmonary simply means lung disease. Okay, lung, 肺脏, lung, paru-paru. Okay, so why I say lung disease is always under-recognized in obesity, because the lung have to handle the capacity. It's overworking, not only the heart, also the lung is overworking because got extra fat, extra weight, and extra burden for the lungs. Normally, I would say obstructive sleep apnea. Number 2 is hypoventilation syndrome. All right, the patients might pass away or during sleep. All right, so for both obese patients. And the lungs, if the patient smoke, a lot of obese patients also smoke, it easily gets chronic obstructive pulmonary disease, COPD, and it's very hard. It's more difficult to treat in obese patients. If you have childhood asthma in obese patients, it's harder to treat. You require more medications to treat. This is related to lung disease. If you get pneumonia, that means lung infections, is very hard to treat also. All right, inpatient, you are stay longer than usual compared with normal population with normal BMI, if you're more obese. The other thing is, if you're obese, if you have certain disease or certain illness that require hospitalizations and you require intubations. Intubation means you connect a tube to a machine to help you to breathe. Okay, this intubation is harder. Okay, if you're over obese, like I have seen 300 kg patients, okay, BMI of 60 to 80, it's very hard to intubate. Okay, and I'm not kidding, and I should not say this, but But if the patients want to send for CT scan or MRI, the normal CT scan or MRI can't afford. To send in ambulance, it's very hard to send also. So in short, pulmonary disease or lung disease definitely increase in obesity.
Okay. So, doctor, the next question, thanks, doctor, for the answer just now. Okay, another question is what? All right. So, what is different? Okay. So, what is the difference between glycoside and metformin, and what time that should take that medication, before or after meal?
Sorry, metformin is?
Metformin and glycoside.
Okay, good. I didn't put the treatment of diabetes. Simply is because I think this is more towards more professions and details. But it's good that you ask so that I can explain what is metformin and glycoside. Metformin is biguanides, and metformin is a anti-diabetic agent that was derived from plant. Okay, from a plant. Okay, so it has been in the market, or it is used very widely, not only diabetes, for pre-diabetes, for PCOS with infertility, and it's widely used for many years. Okay, so it's safe, and it's a safe, and weight is in fact it can reduce some weight, and it comes with no hypo, and it's very well used. Okay, and it has been very good drugs, and it's still the first liner. Okay, the side effects of metformin is more towards GI intolerance. That means you have diarrhea or abdominal discomfort, but it can be titrated according to the doctors, and it can be still used very well even you have some abdominal discomfort. The dose can be titrated. Okay, glycoside is the drugs, we call it sulfonylurea. It is to stimulate the pancreas to have insulin, to secrete insulin, and it has been widely used, and it's a very good drug to reduce blood glucose. However, it comes with side effects. For example, it is weight gain and hypoglycemia. All right, it's relatively cheap, so it has been widely used. Glycoside also comes with usually is used by twice a day. Okay, but nowadays the drugs has been evolved, and we have some drugs we call glycoside MR, diamicron MR, is used daily. Okay, so you have to be careful of this drug that can cause hypoglycemia. So hypoglycemia means low sugar. You will get some symptoms, for example, hunger pang, palpitation, heart pounding, sweating, shivering, and you feel very dizzy, and you have to be careful. Check your blood sugar and take some sweetie drinks, and tell your doctor, I have hypoglycemia, and what to do next. Okay?
Okay.
All right, thanks.
Thank you. Okay. So, okay. So the next question is, can gestational diabetes be cured? Yeah, like during
Gestational
pregnancy.
diabetes. Okay.
Yeah.
Ladies and gentlemen, okay, gestational diabetes is another factor. Gestational diabetes happens in pregnancy. As the word explain, gestational diabetes is happen in pregnancy. We call it pregnancy-induced diabetes. However, we need to be careful because we have too many of undiagnosed diabetes and pre-diabetes. The patient might have pre-diabetes and have diabetes unknown until his pregnancy. So most of the patients might have already had diabetes prior to the pregnancy, and we know pregnancy is a anti-insulin state. That means it's the insulin resistance, or we call it easily get high sugar state. So it is easily get high sugar. Okay, so gestational diabetes has its own risk of pregnancy. Okay, it's not only to the mom, also to the fetus. It can cause a lot of defect on the fetus and cause a lot of problems to the moms. Okay, for example, it can cause baby to get bigger or smaller, or the second one is easily cause a premature baby, or we call it and also increased risk of cesarean section, and also and a lot of risks and complications for the mom and the fetus. Okay, so gestational diabetes need to be emphasized, and even gestational diabetes can lead to type 2 diabetes later in your lifetime. Okay, so you need to have checkup. Okay, all right, for your rest of your life. To answer the question, gestational diabetes can be cured, as the term suggested. Gestational diabetes can occur during pregnancy. Usually after pregnancy, the diabetes can resolve. But however, the risk of getting type 2 diabetes in the lifetime is as high as 50% increase compared with the patients without gestational diabetes. So you need to be aware, are you really gestational diabetes, or diabetes occur before pregnancy? If you are really gestational diabetes, post-pregnancy, usually your diabetes will resolve. But however, your risk of getting diabetes in your lifetime is still very, very high. So just to say, you have the risk of getting diabetes. So you need to be in a good shape. BMI less than 23. This is the answer. Sorry, because when you ask me a questions, all right, I need to explain background disease, background knowledge, and I need to answer this. Okay.
Okay.
Not that I long-winded.
No worries.
To clearly to explain to the audience, because it is important not to get a wrong concept.
All right. Thank you. Thank you. So okay. Our next question is, what is the warning signs or symptoms that my blood sugar are too high? Any signs or symptoms?
Okay, good. Thank you very much. Okay, so signs and symptoms divided into two. All right. So number one is when your sugar is high, usually you are asymptomatic. Simply mean you don't have symptoms. All right. So if the sugar less than 5.6 is normal, you come to 6, 7, 8, 9, 10. There is no symptoms. All right. But however, achieve 8, 9, 10 and above, you might have symptoms of osmotic diuresis. Simply means you feel you pass urine more than usual, you feel more thirsty, you feel you want to drink more water, you feel tired easily, you will feel you like to eat more, your appetite increase. Important message, you have lost weight. Importantly, most of the patient obese start to exercise and suddenly have a lose weight significantly, but it only do minimal exercise, but it lost a lot of weight. Okay, in fact, you are having diabetes, because diabetes, high blood sugar can cause losing weight. All right, so so it's important message. So if you worry that you have diabetes, despite that you lose weight, better check your sugar, see a doctor. All right. So besides that, you might have blurred vision, you might have rash, you might have complications. So symptoms put aside, complications put aside. Two groups. Complications, you might have fungal infections, rashes. You might have heart attack, maybe gone undiagnosed, a long duration of diabetes gone undiagnosed, and you diagnose when you're having complications. That is very, very sad, because it is not reversible. When you got stroke, it's not reversible. or you got heart attack, most likely you have to go through cardiac catheterizations, angiogram, or bypass is not reversible. So the second part is maybe diabetic foot ulcer. All right, you have diabetic neuropathy, that means numbness on your hands and your lower limbs, okay? Or you have proteinuria. You found that biochemically you check your urine, there's a lot of protein in the urine, all right? So it can end up a lot of problems, okay? So one is, to be simplified, one is osmotic diuresis, all the symptoms, okay? And the second one is the complications. And hopefully you diagnose diabetes is not when you have complications, because you want to diagnose your diabetes without complications so that we can prevent you to get complications. Okay, right?
Okay. All right. Thank you, doctor. Okay.
Thank you very much.
Okay. So because of the time, so we will take the last 3 questions. Okay.
3 questions. All right.
Or you can be still be longer, doctor.
All right. Okay.
So all right. So
I'm glad to share with you. Okay.
Okay. So thank you very much. Okay. So now the next question is, high protein in urine, does that mean toilet bowl will see the ants around?
High protein,
urine,
high sugar. Okay.
Yeah.
Okay. Initially, diabetes mellitus come from a word that urine. All right. High sugar in urine. Those days, there's no glucometers, there's no blood. Usually, we diagnose urine is high sugar in the urine. All right. So, but to have ants, Maya has itu semut-semut datang untuk cari gula-gula dalam kencing. It implies that there is very high sugar in the urine. All right. That means your sugar definitely is more than 10. Okay. It's just a rough number. Okay. So before that, I explain, our kidney, before kidney produce urine. Before you passing urine, your kidney have to reabsorb all the protein and the sugar. If your kidney spoiled or there's damage to your kidney, all right, that means the kidney cannot reabsorb the protein. The protein will appear in the urine. It indicate your kidney has been damaged due to whatever reason it is. All right. Number 2, your kidney should reabsorb the sugar. If sugar appear in the urine, that means your sugar in your blood is very, very high. The kidney unable to reabsorb. All right. So it simply implies that you have very high risk of diabetes. In fact, you might have been diabetes, and if you have protein, it means your kidney damage. If you have protein in the urine, it shows that your kidney damage is the first few stages of getting kidney problems in diabetes. We are worried about protein in the urine if you are diabetic. It shows that your dialysis time is just around the corner. Okay, 3 to 5 years time if you're not well controlled.
Okay.
Can you see the seriousness or not?
Yes.
各位观众，你可以知道糖尿病的危险啊。如果你发觉到你尿液里面有蛋白质或者是糖的话呢，这个是我们医生很担心的，因为这个呢已经是给了一个 warning signal， 就是一个警告，是跟你说，就是你要洗肾的时间呢已经不长了，已经是在眉头了。我们讲然在眉头了，好，已经不是10年、20年的时间，是3年到5年的时间，你就要洗肾了。好，OK， 谢谢。
Okay， 谢谢医生。Okay, then another question is, can children get diabetes also? Can they diagnose? So, can you share maybe how youngest patient you have for kids?
Right. Okay. Children in the past, the type 2 diabetes, which is obesity related, is low. All right. Usually children to adolescents, okay, is having diabetes. Usually is type 1 diabetes. It's autoimmune in nature. That means the immune imbalance of the immune system that cause type 1 diabetes. All right. However, due to our genetics, generations, okay, as I say, when you have one generation of 40 years old, okay, your next generation will be earlier, 30 years old. So 30 years old, the next generation will be 20 years old. All right. So plus your environmental factor means sedentary lifestyle and food itself, food that promote obesity and lack of exercise can prone the patients that becomes childhood obesity. Okay, childhood obesity definitely is a very high risk factor for childhood diabetes. To answer the question, yes, child can have diabetes as low as 9 years old. What I see. Type 2 diabetes occur in a child at 9 years old, obese patient. All right. So parents who are in the 9, please keep your children healthy. How to see? Balanced, healthy diet. Stay away from high sugar. All right. High sugar, all the bubble tea, all the I can't say because I can't say all the bubble tea, all the sweetened drinks, high carbo, high fat, high carbo, fried chicken, whatever, we need to minimize. We can't avoid because when you go to mall, these are the food, these are the drinks, okay? But try to minimize, okay? All right.
Okay. All right, thank you. So next question is, how often should I replace my glucose meter and Lancet? Let's say have
good questions. All right. Okay. Glucometer come with the strips. Okay. And I understand strip is expensive. However, there is no other chances or no other way to know your blood sugar, because I don't have X-ray eye to see that, oh, your sugar is 10.9. No, I don't have. I have to see according to the numbers. So glucometer is the best tool, the best monitoring tool, and it's a best friend for diabetic patients. All right, this is one. All right, glucometers, it comes with guarantee. So different company give different guarantee. Calibration is very important, because if not calibrate, it is very far away from the actual number. It can lead to disastrous results. Let's say your sugar is 20, but the sugar glucometer detect is 10. Then you think it's good. Then you eat more. In fact, the glucose is already achieved more than 30. So discrepancy of from your glucometer from the actual sugar need to be emphasized if your glucometer use more than 6 to 1 year. So how do I recommend most is you go to the pharmacist or go to the clinic or hospital. Their sugar, their glucometer is accurate. Okay, their glucose accurate. So you check your sugar.
Yes.
To 2 different glucometer. One is yours, one is the pharmacist or the clinic one, and you see any discrepancy. More than 10% is not good. Let's say when you check is 5 and the pharmacist one is 6. Okay, 5, the 10% is 0.5. So 4.5 to 5.5 is still okay. Okay, but 6, maybe yours need to be calibrated. Okay, give another example. If your sugar is 7 and the pharmacist one is 7.3, the difference is 0.3. 10% is 0.7. Less than 0.7 is acceptable. Some say need to less than 5% is more accurate. I agree, but I think 5 to 10% should be okay. All right.
Okay.
So what next?
If you find discrepancy, either you can find back the company, buy back the pharmacist that sell your glucometer, and go back to calibrate, calculate the cost. If the cost is higher, then you buy another one. Go forward to buy another one. Okay, because now the function is getting more advanced. You can connect it to your smartphone. You can come to a PDF. It can have a different warning sign. If it's too low, it will give you some signal, and it comes with a different budget. Okay, different system come with different budget. Okay.
Okay, thank you. So now there is another question. Is there any way to improve the kidney health?
Okay, the kidney health, okay, it's the same. Okay, number one, control your sugar. Number two, control your cholesterol. Number three is control your blood pressure. Okay, different kind of patients, okay, have a different kind of target level. Okay, so generally control your 3 high first. Okay, the other thing is avoid nephrotoxic drugs. What is called nephrotoxic drugs is the drugs that can damage your kidney. Most of the time is painkillers. Ladies and gentlemen, whatever you have pain and the doctors or the pharmacists tell you, you have to tell the pharmacist or the doctors, I have kidney problem, I have diabetes. Okay, the doctors and the pharmacists know to prescribe a kidney-friendly painkillers to you. All right. Then you have to, if the kidney is very advanced, try to avoid high potassium medications. All right, and keep yourself hydrated. That means drink more water. But this depends, because online there's a difficulties because I can't see you. I do not know your patient profile. I can just give a general statement. Okay, I apologize if I give a wrong message because you might have a different kind of patient profile. But generally, a patient, how to take care of a kidney is to drink more water. But if you have cardiac failure, that means you need to restrict feed. This is the different kind of pictures. So again, control your blood sugar, cholesterol, blood pressure is important, and avoid nephrotoxic drugs and avoid salt. Okay, salt is another toxic things. Okay, our food a lot of MSG, monosodium glutamate. MSG, 味精 that stimulate your appetite, let you to eat more so that you can buy their food. Okay, so you can think about their food, you want to eat more. Okay, so these MSG contain very high sodium, and high sodium will overburden your kidney. So low salt diet is important. Okay.
Okay, thank you. Okay, so do you have any other question? Okay. Okay, another question, doctor. Right.
Okay.
So what are the long-term complications of diabetes and how can I avoid them?
Okay, the long-term complication, as I say, divided into two parts. No? Okay, so I explain in a layman term, diabetes is high sugar, all right, and we have vessels in our body. Okay, our body full of big vessels and small vessels. Vessels that is just like a longgang. All right, a longgang, 水管 is a pipe that transfer nutrients and oxygens towards your tissues use. Okay, so it's the pipe. All right, so the pipe contains blood, and if you high sugar, you high blood pressure, and you have also high cholesterol, it's easily cause obstruction.
Okay.
It easily cause dirt, obstructions, and damage to the blood vessels. Okay, when you damage the blood vessels, it can come with complications. So generally, we divide into two parts: microvascular complications and macrovascular complications. That means big vessels and small vessels. All right. So what are the organs that have high quantity of vessels? Guess.
High quantity.
Guess. 有哪一个器官是富有很多血管的？
很多血管啊，心脏吗？
心脏 ，OK， heart got a lot of blood vessels.
嗯
Brain a lot of blood vessels. Hands, our hands a lot of blood vessels. Okay, our eye a lot of blood vessels. Kidney is a lot of blood vessels. Okay, so when they damage all of these organs. So generally, macrovascular complication is stroke, heart attack, peripheral vascular disease. All right. Microvascular small vessel disease is eye can get blind, peripheral neuropathy. That means numbness, diabetic foot ulcer, and also kidney will require dialysis. Very one important, diabetes can lead to erectile dysfunction. Okay, for male patients. Okay, all right. How to prevent? The same thing. Prevent low sugar. Optimize the sugar. Optimize the lipids. Optimize the blood sugar. Blood pressure.
Okay, thank you, doctor. So I think that's all question from the floor.
Okay, thank you very much. Thank you for your attention.
Okay, so if you have any question, you can always call Dr. Lim at 03-977-2919, extension 9355. If you have more questions to ask Dr. Lim in personal, I mean, maybe they are not convenient to ask here. Right? So you can always contact him from Sunway Velocity Medical Center. And thank you so much for your time, for your information.
Okay, so again, so in conclusion, I hope ladies and gentlemen understand about diabetes and obesity, and prevention is always better than cure. So for your information, Sunway, because due to MCO, we have understand that patients might not want to come to hospital to avoid get infected. However, Sunway Velocity Medical Center, Sunway Medical Center Velocity has taken a lot of steps to prevent transmissions of COVID if it's there. For example, hand washing, whatever, and take very, very important steps. And all the staff is wearing masks, and in fact, it's very clean. I mean, very clean hospital. The second one, if you still think that visiting hospital is not an option, you can choose to consult doctor via the telemedicine, telecommunications. You can online to find Sunway Medical Velocity web page, and then you can click online. Then we can arrange. Okay. So of course, telemedicine has its restrictions. The best is still you come, but you can choose. All right. Thank you very much.
Thank you very much. Okay, so if you have any questions regarding insurance on this diabetes, okay, we Allianz also have this type of insurance. Okay, so if you are interested, you can always call us. Okay, and then we also prepare the Google form. You can put your information there so that we can contact you. Okay, so thank you, doctor.
Thank you very much. Thank you very much.
Thank you for watching our live today. Okay.
COVID time, stay healthy and safe. All right, for everyone. Thank you very much.
Thank you, doctor. Thank you. Bye.